Hey gang, Chad Madden here, and I often get asked the question, how do I know if I have degenerative disc disease? You might have seen there was a recent study published where they looked at people on an MRI or an X-ray or a CT scan that had degenerative disc disease. And these were in people that had no pain. So if you're 50 years of age and you're American, there's an 80% chance that you have degenerative disc disease on an MRI or a CT scan. If you're 70, it jumps up to 92%. So almost everybody, whether you have pain or not, has disc degeneration on a CT scan, even if you don't have any pain at all. So really, really confusing. How do we know? At the end of this video, I'm going to give you a 30-second self-test that you can quickly do right now just to see if disc degeneration is the cause of your pain. So when we're talking about it, there's another little set of rules that'll really help us decide if you have it. So if you're 50 years of age or older, if you have pain with standing and walking. So like, have you ever seen in the grocery store, there's somebody frequently will lean forward on the grocery cart as they're walking through. They need that grocery cart support. Why are they doing that? Well, I'm going to show you here in a second. But if they have increased pain with standing and walking and they have relief with sitting, so your pain goes away when you sit down for a few minutes, then there's nearly a 100% chance that disc degeneration is the cause of your pain. So, and by the way, it can cause back pain, sciatica, pain, numbness, and tingling running down the legs. Some people also say burning or weakness, heaviness. So how does degenerative disc disease work? Well, I drew this out really quick, but what's this right here? Vertebrae, so bone in your back. What's this right here? Vertebrae. Most common level for disc degeneration is L4 and L5. So if this is bone and this is bone, what's this in between? That's right, it's your disc. And then what happens as we age? That space shrinks down. Well, what that does is this hole in the back, by the way, this person is facing that way. So it's like taking a look at me, a picture from the side, and the person is facing this way. So their stomach would be right here, this is their back, this is the disc. This hole where the nerve comes out right here, it's called a foramen. You don't have to remember that, just remember there's a hole where the nerve comes out. And what happens is, as that space shrinks down and those vertebrae get closer together, that hole closes down as well. And it can eventually clip the nerve or put pressure on the nerve. And what will happen, that's why when we see that person in the grocery store leaning forward, or if this is you, leaning forward, what does that do to the hole? That opens it up. What does it do when we stand up and we walk? It closes the space down. And this is the person that generally throughout the day, their pain will increase. So later on in the afternoon, they've been up for a while, they have the effect of gravity all day long. What they tend to do is they tend to have more pain. When they wake up in the morning and they feel okay, but they're really stiff because there's no gravity when they're laying in bed, so that space fills back up with fluid to some extent, but it stretches all those muscles, tendons, ligaments, and they feel really tight. They usually have to get a hot shower or move around for 15 minutes before they feel normal again. Usually the morning's okay, and then when the afternoon comes around, evening comes around, because of the effects of gravity, once again, now they start to have pain. So that's how you know if you have disc degeneration, at least from your history. Now, what I want to show you is a really quick, simple self-test that you can do. So here's what you're going to do. Stand up. You're going to put your hands on your lower back just like this, and then just lean back as far as you can comfortably. Try not to fall over or anything like that. But if that increases your pain, what you're doing, again, you're closing that hole down. So when you lean back, you're closing that foramen down, that hole. Great. And back up. So if that causes pain in your lower back, pain, numbness, tingling, burning, or heaviness down your legs, then there's a really good chance that you have disc degeneration. Now, I have a series of exercises that you can do that are really, really simple, easy to do. You can do them in the safety and comfort of your own home. I'll put a link in the description. Also, I'll link the study that just came out that shows the number of people without pain that have disc degeneration on an MRI or CT scan. Frankly, here at Madden Physical Therapy, we see a lot of people who come in that think that they have disc degeneration. We go through this test plus other tests, and they don't have that going on. They have another problem. I'll talk about that in another video. As always, you can hit the like button, leave a comment below. I'll be sure to answer your questions, and I'll see you in the next video.